Hello, my name is Jessica Oliver, and I will be covering child abuse and maltreatment in this presentation for Azusa Pacific University, with content from Wong's Essentials of Pediatric Nursing. In 2011, Child Protective Service agencies in the United States confirmed that an estimated 681,000 children were victims of one or more types of abuse. About 79% of cases involved neglect, about 18% physical abuse, 8% emotional or psychological abuse, and about 9% sexual abuse of children. According to the California Board of Registered Nursing, registered nurses are among the health practitioners who must report known or observed instances of abuse to the appropriate authorities. Registered nurses must also be aware that failure to report as required is also considered unprofessional conduct and can result in disciplinary actions against the RN's license by the BRN. The circumstances under which a mandatory reporter must make a report do vary from state to state. Typically, though, a report must be made when the reporter, in his or her official capacity, suspects or has reason to believe that a child has been abused or neglected. Mandatory reporters are required to report the facts and the circumstances that led them to the suspicion, but they do not have the burden of providing actual proof that abuse or neglect has occurred. Next, we are going to review the different types of child maltreatment, starting with child neglect. Neglect is generally defined as the failure of a parent or other person legally responsible for a child's welfare to provide for that child's basic needs and an adequate level of care. Child neglect is actually the most common form of maltreatment, and about 50% of reported neglect cases involve children 5 years old or younger. So there are different types of neglect: physical neglect and emotional neglect. Physical neglect involves the deprivation of the basic necessities such as food, clothing, shelter, supervision, medical care, and education. Emotional neglect generally refers to failure to meet the child's needs for affection, attention, and emotional nurturance. But neglect may also include a lack of intervention for or even fostering maladaptive behavior itself. So emotional abuse, or also called psychological maltreatment, is defined as a deliberate attempt to destroy or impair a child's self-esteem. This could be through rejecting, isolating the child, terrorizing, ignoring, corrupting, verbally assaulting, or pressuring the child. Physical abuse is the deliberate infliction of physical injury on a child, usually from the child's caregiver, and can result in minor damages such as bruises and fractures to major occurrences such as brain damage and death. Minor physical injury is actually responsible for more reported cases of maltreatment than major physical injury, but major physical abuse causes more deaths. Despite the importance of this problem, a universally accepted definition of what constitutes major or minor physical abuse does not exist. States actually define abuse according to their own individual reporting laws. Abusive head trauma is a serious form of physical abuse caused by the violent shaking of infants and young children. It's the leading cause of death in children less than 2 years of age. It's also known as shaken baby syndrome, inflicted head injury, or neuro-inflicted brain injury. This is correlated with a high mortality and morbidity. 25 to 30% of the infants with shaken baby syndrome end up dying. Survivors end up with lifelong neurologic and cognitive deficits. Why are infants so prone to damage? Well, they have a large head-to-body ratio. They have weak neck muscles and a large amount of water on the brain. Therefore, violent shaking causes the brain to actually rotate within the skull itself, and the shearing forces that are caused by this tear blood vessels and neurons. The classic triad of signs of abusive head trauma include intracranial bleeding, which is subdural hematoma or subarachnoid hematoma, cerebral edema, which is the direct result of trauma to the brain, and retinal hemorrhages, which occur in approximately 80% of cases. This is diffuse and in multiple layers of the retina, and these hemorrhages extend out to the periphery of the retina as well and will be seen bilaterally. However, the classic triad doesn't definitely diagnose. These patients still need a full investigation involving medical and social services and law enforcement as well. They're often not an isolated event, and many show evidence of previous injury. Munchausen syndrome by proxy is a rare but serious form of child abuse. It's also known as medical child abuse or factitious disorder by proxy. And it's when a caregiver, usually the biological mother, exaggerates or fabricates the signs and symptoms of an illness in a child, who is the proxy, to gain attention or gratification. The child may end up undergoing needless and painful procedures and treatments. And in some cases, they may be fatal to the child. This maltreatment may be physical, emotional, or psychological, and common symptoms seen in the patients are seizures, nausea and vomiting, diarrhea, and altered mental status. So, some important things to think about if you're the medical service provider and you are seeing a child who may potentially be in a Munchausen syndrome by proxy situation. Is the child's condition consistent with the reported history from the caregiver? Does the diagnostic evidence even support the reported history? And has anyone other than the caregiver witnessed these symptoms? Those are all important to think about. There are three main groups of risk factors that predispose children to physical abuse. The first is parental characteristics. The younger the age of the parent, the single parent, and the presence of an unrelated partner are all risk factors for child abuse. Also, low self-esteem, a poor parenting knowledge base of the parents, and a poor parenting role model for parents also put the child at risk. Now, the onus of abuse is always on the parent and not on the child. However, there are some common characteristics of the child that seem to correlate to abusive situations. The first is age from newborn to 1 year. Remember, those are the times when babies are most at risk for shaken baby syndrome due to crying. Is the child physically disabled? Are they hyperactive? Are they premature? And do they have chronic conditions that might cause increased caregiver role strain? The third group is environmental characteristics. These include social isolation and poor support systems. Parents who also have chronic stress are in poverty, in a divorce situation, or if substitute caregivers like babysitters or daycare centers are present, these are all increased risk factors for child abuse. We will use the U.S. Department of Health and Human Services definition of sexual abuse. The employment, use, persuasion, or coercion of any child to engage in or insist any person to engage in sexually explicit conduct or simulation of such conduct for producing visual depiction of such conduct, or the rape, molestation, prostitution, or other form of sexual exploitation of children or incest with children. That is our term for sexual abuse. Now, there are different types of sexual maltreatment that we'll define here. Incest involves any physical sexual activity between family members, and blood relationship is not required. Abusers can include step-parents, unrelated siblings, grandparents, uncles, and aunts. And it does not include sexual relations between legally sanctioned partners, such as spouses. Molestation is actually a vague term that includes indecent liberties, quote unquote, such as touching, fondling, kissing, single or mutual masturbation, or oral genital conduct. Exhibitionism is indecent exposure, usually exposure of the genitals by an adult man to children or women. Child pornography is arranging and photographing in any media sexual acts involving children, alone or with adults or animals, regardless of consent by the child's legal guardian. Also may denote distribution of such material in any form with or without profit. Child prostitution is involving children in sex acts for profit and usually with changing partners. Pedophilia literally means love of child and does not denote a type of sexual activity, but rather the preference of the adult. Next, we'll list a few characteristics of abusers and their victims. The typical abuser is a man who the victim knows, but it may be anyone. Abusers may come from all socioeconomic backgrounds and all levels of education. Offenders are often employed in positions that bring them into close contact with children, but not always. The abuse may be generational. Abusive behaviors may be passed on from generation to generation. Victims are frequently reluctant to report due to fear of retaliation, which further supports the abusive situation. Now, on to the nursing care of the maltreated child. It's very important to try and identify abusive situations as early as possible. When children report potentially sexually abusive experiences, please take their reports seriously, but also cautiously to avoid alarming the child or falsely accusing someone. Therefore, a detailed history and very thorough physical examination pertaining to the incident must take place. Also, look for evidence of maltreatment. Is there a pattern or combination of indicators that arouse suspicion and require further investigation? Sometimes child and caregiver histories of events do not match, or there are inconsistent or incongruent behaviors that may flag you to the evidence of maltreatment. Incompatibility between the history and the injury is probably the most important criterion on which to base the decision to report suspected abuse. The child must be protected from further abuse. The priority here is to remove the child from the abusive situation and prevent any further injury, and then support the family. Of course, accusations of abuse and evidence of abuse may spawn anger, depression, grief, denial, and you must be prepared to support the family in this situation. And finally, the prevention of abuse. Nurses actually play an important role, for a nurse might be the very first one to discover abuse. First of all, nurses can identify risk factors on home visits. During prenatal visits, nurses can prepare families for adjustment to parenthood and what to expect. Nurses can foster the attachment process in the postpartum setting. In an ambulatory settings, they can teach appropriate methods of bathing, feeding, toileting, disciplining, and preventing further injuries. Also, nurses must be sensitive to parental needs for attention, reassurance, and reinforcements, and should refer parents to community services and self-help groups when necessary. Thank you for taking the time today to review this PowerPoint on child abuse and maltreatment. I know the topics can be very hard to think about and hard to discuss and can weigh very heavy on your heart. It's very important, though, that you have a foundational knowledge base on what the different types of abuse are and how they may present in children. Thank you for your time.